Hi, my name is Dr. Delia Garcia, and I wanted to briefly share my story of how I went from full-time healthcare to reinventing myself as a health coach. So my background is that of oncology, specialized in breast cancer, and I practiced that specialty for 30 years. I loved every minute of it. I would do it all over again in a heartbeat. And so I was able to meet thousands of beautiful women and their families and to offer my advice, my expertise, and to care for them, when they were first diagnosed with breast cancer and care for them along their journey, some of them at the end of their journey. The wonderful thing about breast cancer, however, is that most women who are diagnosed do very well. So the cure rates are very high, and that was something that was very gratifying to me. And but as time went on, I started to see younger and younger women with breast cancer, women that were no longer in their 50s and older, although I still saw older women, but I started to see women in their 40s, 30s, 20s. I even had a 17-year-old that came in one day with her mom and dad to talk about her breast cancer treatment options. And that is not normal. It's like seeing those 8-year-old children diagnosed with type 2 diabetes because they struggle with weight issues. So this 17-year-old was probably about 100 pounds overweight. Certainly, that was not her only risk factor, being that young, but it just was not normal for young people to come in with a diagnosis of breast cancer. So I did that for 30 years. Along the way, I was looking for a tool to help my patients live that better life, to get to that healthier weight, to reduce their risk of a recurrence or another breast cancer. And as I was out and about in the community lecturing and being asked to deliver talks for various groups, and even within the university where I was initially a faculty member, I shared the fact that there was a huge link between our body weight and breast cancer. So in women that are postmenopausal, the biggest source of estrogen is our own body fat, and that is a precursor for breast cancer. So achieving a healthy weight is so important in reducing the risk of breast cancer. And for those women that already have a history of breast cancer, reducing their risk of a second cancer or of a recurrence. And of course, we know that being overweight and obese is also a huge risk factor for heart disease, diabetes, hypertension, other cancers such as colorectal, pancreas, prostate, and so on and so forth. So it became part of my practice, um, counseling people on diet and lifestyle. And eventually, I did discover a wonderful tool, the program that I have now been coaching for 15 years, and that I have been coaching outside of mainstream medicine for the past 10 years. And so the wonderful thing for me was to have that tool that was helpful to my patients, but also to have that for myself. I didn't realize until I left mainstream medicine how really, I don't even want to use the word dysfunctional my life was, but how busy and crazy it was. I had no time for anything except working, working, and working. I missed things with my children. I really didn't have any friends. I know that sounds kind of pathetic, but when you're working and taking care of family, that happens. You become very isolated. So as a health coach, I now can help people achieve a healthy weight. Many of them are able to eliminate medications and even reverse diseases such as diabetes, hypertension, and other chronic diseases, lower their risk of heart disease, for example. We can't make any claims, but reality is if people get to that healthier place in their lives, they are going to be able to achieve some of those things, getting off their medications and reversing some of those chronic diseases. But what has happened for me is just short of miraculous. I have a balanced life. Yes, I work hard. I help people. I get referrals. One of the things that I've been really blessed to do as well is to help other people be able to do what I'm doing, to change their career path, to have more balance by becoming health coaches. So I develop, train, and support people that want to do that. It's a mentorship, it's a modeling. And I love doing that, giving other individuals and families the opportunity to create the life that I am able to live now. And it doesn't get any better than that. And so if you would like to learn more about health coaching and our program, please talk to the person that invited you. But there is nothing out there like what we do. We walk alongside people. We support and guide and love them to that better life that most people are hoping to achieve. And I want to share one slide with you. And this is a slide of my life now. I work from home, which is wonderful. I get up in the morning. I'm an early riser, and I can walk to my office, my home office on the same floor as my bedroom, or I can come down to the kitchen or my outdoor patio and do what I do as a health coach. Work with individuals, with families, and work with other health coaches and teams of health coaches. So I get to work from home. How wonderful is that? I get to travel. I love traveling. And before, when I was working full time as a physician, I was lucky to be able to take a week's vacation. And I spent most of that vacation worrying about the work I left behind, and then spending a few, great days on that vacation, and then worrying about the work that I was going to encounter when I got home again. So traveling is wonderful, and you can do health coaching from anywhere with a laptop, a cell phone, and internet access. I now have so many friends. I love to entertain in my home. I had missed that when I was practicing. I just didn't have the time to make connections, to meet new people, and to have them over for dinner or cocktails, or just getting together and spending quality time together. I have more time to spend with my adult children. Here you see pictures of me with my beautiful daughter. And then my boys are the two that look like my mother's bodyguards. My mother, when she was in the last year of her life, or the last couple of years of her life, she spent a lot of time in my home. And I was able to do that because I work from home. And so I could get her breakfast and lunch and take her to movies and, just take care of her. It was just so wonderful. She never spent one day in a nursing home. And that is priceless. I have time to exercise. I love yoga. I'm good at it. I've done it for more than 20 years. So I do yoga 3 times a week. And on my non-yoga days, I do some kind of of cardiovascular spinning or jogging or brisk walking. It's just so much fun. And I have two amazing pets, my cats, and they follow me all over from one place to another. Before I barely, paid attention to them. So that is my life now. And I would love to share it with other people who are looking to create balance in their lives. Maybe that plan B, leaving a stressful corporate job. And I love, love, love working with health professionals, because there are so many health professionals that are burned out and they are just barely surviving. They're spending long hours in the office, and then they come home and they are spending hours and hours uh, charting on the electronic medical record. And there comes a time when we look at our lives and we think, is this all there is? Is this all there is? So I have been able to, again, just create a different life for myself, helping a lot of people, creating great income, and I'd love to share it with others as well.